Imagine a patient rushed to the emergency room, struggling to breathe. Doctors need information fast to make life-saving decisions. This is where arterial blood gas, or ABG analysis comes in. ABG is a powerful tool that provides a snapshot of the body's respiratory and metabolic health. It measures the levels of gases and chemicals in the blood, specifically from an artery. It helps doctors assess how well your lungs are working. It also reveals how effectively your body is regulating its pH balance. Think of ABG analysis as a window into the body's internal environment. By analyzing the delicate balance of gases and chemicals, doctors can diagnose and manage a wide range of medical conditions. From respiratory failure to kidney problems, ABG analysis plays a crucial role in guiding medical interventions and improving patient outcomes. Collecting an ABG sample involves a slightly different procedure than a typical blood draw from a vein. Instead of a vein, a small amount of blood is drawn from an artery, usually in the wrist. Arteries carry oxygen-rich blood, providing valuable information about lung function. Before drawing the blood, a simple test called the Allen test is performed to ensure adequate blood flow to the hand. Once the site is cleaned and prepped, a thin needle is inserted into the artery, and a small amount of blood is collected in a specialized syringe. After the needle is withdrawn, pressure is applied to the site to stop any bleeding. The collected blood is then immediately analyzed in a machine called a blood gas analyzer. An ABG test measures key components, providing critical information about the body's respiratory and metabolic state. These include pH, PCO2, PO2, and HCO3. pH reflects blood acidity or alkalinity. PCO2 measures carbon dioxide pressure. PO2 measures oxygen pressure. HCO3 measures bicarbonate levels. pH is a measure of how acidic or basic a solution is, and in the context of ABG analysis, it refers to the acidity or alkalinity of the blood. The body maintains a tight pH range, typically between 7.35 and 7.45, which is slightly alkaline. Think of pH as a delicate balancing act. The body constantly works to maintain this narrow range, as even small deviations can disrupt normal bodily functions. Acidosis occurs when the pH falls below 7.35, while alkalosis occurs when the pH rises above 7.45. Many factors can influence blood pH, including lung function, kidney function, and metabolism. For example, if the lungs are not effectively removing carbon dioxide, it can build up in the blood, leading to respiratory acidosis. Conversely, if the body loses too much acid, such as through prolonged vomiting, it can lead to metabolic alkalosis. Maintaining a healthy pH balance is essential for cell and organ function. Section 5. PCO2. Measuring carbon dioxide levels. PCO2, or partial pressure of carbon dioxide, is a crucial component of ABG analysis that reflects the lung's ability to remove carbon dioxide from the body. Carbon dioxide is a waste product of metabolism, and its levels in the blood must be carefully regulated. Imagine the lungs as bellows, constantly working to expel carbon dioxide and take in oxygen. When we breathe, carbon dioxide from the blood diffuses into the tiny air sacs in the lungs called alveoli and is exhaled. Normal PCO2 levels typically range from 35 to 45 millimeters of mercury. Elevated PCO2 levels, known as hypercapnia, can indicate that the lungs are not effectively removing carbon dioxide. This can occur in conditions such as chronic obstructive pulmonary disease or COPD and asthma. Conversely, low PCO2 levels, known as hypocapnia, can occur when the body is eliminating too much carbon dioxide, such as during rapid breathing or hyperventilation. Monitoring PCO2 levels provides valuable insights into respiratory function and overall health. Section 6. PO2 and HCO3. Oxygen and bicarbonate's role. In addition to pH and PCO2, ABG analysis also measures PO2 and HCO3, providing a comprehensive assessment of respiratory and metabolic status. PO2, or partial pressure of oxygen, reflects the amount of oxygen dissolved in the blood. Think of PO2 as a measure of how effectively oxygen is being delivered to the body's tissues. Oxygen is essential for cell function, and low PO2 levels, known as hypoxemia, can be a sign of lung disease, heart problems, or other conditions. Normal PO2 levels typically range from 80 to 100 millimeters of mercury. HCO3 or bicarbonate is a buffer that helps regulate pH by neutralizing excess acid. It acts as a chemical sponge, soaking up excess hydrogen ions, H+, to maintain pH balance. Normal HCO3 levels typically range from 22 to 26 milliequivalents per liter. Abnormal bicarbonate levels can indicate metabolic imbalances such as metabolic acidosis, low HCO3, or metabolic alkalosis, high HCO3. Together, PO2 and HCO3 provide valuable insights into oxygenation and acid-base balance. Section 7. ABG in Action Real-World Applications. ABG analysis plays a critical role in various medical settings. Let's explore some real-world applications of ABG analysis. In emergencies like heart attacks or severe asthma, ABG analysis helps assess respiratory and metabolic status. It guides decisions about oxygen therapy and ventilation support. In ICUs, ABG analysis monitors patients on ventilators and those with severe infections. It helps optimize ventilator settings and manage electrolyte imbalances. Respiratory therapists use ABG analysis to assess lung function and adjust treatments. These examples highlight the importance of ABG analysis in different medical specialties. Section 8. Putting it all together. ABG interpretation. Interpreting ABG results involves considering all four components: pH, PCO2, PO2, and HCO3, together to create a complete picture of the patient's condition. It's like solving a puzzle, where each piece provides clues to the underlying problem. For example, a low pH, acidosis, with a high PCO2 suggests respiratory acidosis. This indicates a problem with the lung's ability to remove carbon dioxide, such as in COPD or pneumonia. On the other hand, a low pH with a low HCO3 suggests metabolic acidosis. This can occur in conditions like diabetic ketoacidosis or kidney failure. Interpreting ABG results requires a good understanding of acid-base physiology and the interplay between the respiratory and renal systems. Healthcare professionals use their knowledge and clinical judgment to correlate ABG findings with the patient's symptoms, medical history, and other diagnostic tests. Section 9. The power of ABG importance in patient care. ABG analysis provides a window into the body's respiratory and metabolic state. It plays a crucial role in diagnosing and managing medical conditions. By measuring gases and chemicals in arterial blood, ABG analysis helps assess respiratory function, evaluate acid-base balance and guide treatment decisions, monitor patient progress and track treatment effectiveness. ABG analysis empowers healthcare professionals to make informed decisions.